Before we look at what you can do to battle and defeat your diabetes, we need to look at some essential equipment that you will need in that process. First of all, you will need alcohol swabs, lancets, a glucometer, test strips, and gauze pads. In this battle with diabetes, it's essential for you to know how your body is responding to various treatments, and the only way to know for sure is to measure your blood sugar levels regularly. Put a test strip in your glucometer, clean the side of one of your finger pads with alcohol swab, and then let it dry. Then poke the side of your finger with a lancet and squeeze the finger to make a drop of blood appear. Wipe the drop of blood away with a gauze pad and then squeeze the finger again to get another drop of blood. Put the end of the test strip into the drop of blood and allow the blood to soak into the end or side of the test strip. The glucometer will beep at you in a few seconds and will show you the blood sugar reading. Wipe away the remaining blood with a gauze pad and or alcohol swab, and you're done. Are you on diabetes medication? If so, you will need to work closely with your doctor as you apply the principles that we will cover in these lectures. Because if you follow these instructions, your blood sugars will go down, and you will need to decrease or stop some or all of your diabetes medications. When or how often should you measure your blood sugar levels? If you are not on any medications for diabetes, measure your blood sugar levels every morning before you eat or drink anything. If you are on oral medication, taking pills for diabetes, you should measure blood sugar levels at least every morning, but if your doctor has told you to measure more often, then measure more often. If you're on insulin, you should be measuring your blood sugar levels every morning, 2 hours after breakfast, before lunch, 2 hours after lunch, before supper, and before bedtime. You should keep up this routine until you have a predictable routine and your blood sugar levels are not going above 250 milligrams per deciliter or below 70 milligrams per deciliter. If you're on insulin, you should be working closely with your doctor on your insulin dosage and on how often you should be measuring your blood sugar levels. How do you interpret the results of what you get? Well, if your fasting glucose is between 70 and 89, that's normal. If it's between 90 and 125, that's pre-diabetes. Again, some organizations say 100 or 110 is the lower cutoff for pre-diabetes. And if your fasting glucose is 126 or greater, that's diabetes. You want to aim for a fasting blood sugar between 70 and 89. That's your goal. If you can maintain your fasting blood sugar below 90 without medication, you can reverse your diabetes. And this is what we want. In our next Health Nugget, we will be looking at the 13 steps you can take to reverse your diabetes. So keep an eye out for the next Health Nugget.